coronavirus in Victoria. That's 6 new cases since yesterday's report. 4 of those are linked to known outbreaks and complex cases, and 2 are under investigation by our public health team. 2 cases were reclassified. I'm sad to say there have now been 809 Victorians pass away as a result of the global pandemic. That's an increase of 2 since yesterday's report. 1 female in her 80s, 1 male in his 90s. There are 16 Victorians in hospital, 2 are in intensive care, and neither of those 2 are on a ventilator. A total of 2,780,231 test results have been received since the beginning of the year. That's an increase of 16,429 tests since yesterday. Can I thank each of those almost 16,500 Victorians who got tested just the day before? That's a really important thing and something we're deeply grateful for. That's a very strong number, and if you combine that with the previous 2 days, which essentially reflect the weekend, to be well into the 9,000s over the weekend, both days of the weekend, is an improvement on total numbers in terms of the recent trend. I know I've said this literally thousands of times, but I will say it again because it's arguably the most important thing you can do. If you've got symptoms, any symptoms, mild, no matter how mild they are, don't wait till tomorrow. Please go and get tested today. And the basic logic behind that is if we can find you as positive, then we can protect you, we can help you protect your family, and in turn we can protect every family, put a public health response around you and your family, wrap our arms around you and make sure that you're properly supported, and make sure that you're not inadvertently spreading this virus to other families. What we've seen in recent days, whether it be Frankston, Chadstone, Kilmore, Benalla, we've seen patterns that can run literally the length of our state, and they run quickly. This thing is wicked, as we've said on so many occasions, and I think all Victorians know and understand this. It's silent often with very mild symptoms. It is rapid in that it moves very, very quickly, and it can be away from you well before anyone's been to get a test. That's why it's so important. Even the mildest of symptoms, please don't put getting tested off. Please go and get a test as soon as you possibly can. There's more than 200 sites across the state. Jerome is here today to speak about some of the targeted testing work we've done in and around Chadstone, the Kilmore community who've done an amazing job. Can I thank everybody in the Kilmore community for coming forward to get tested? Jerome will speak to that in more detail, but this only works if everybody buys in, if everybody plays their part, and there's no greater responsibility and there's no greater contribution that a symptomatic Victorian can make than to get tested, and to get tested fast. We'll get your test results back to you very quickly, and then we can put that response in place to protect you and to protect everyone, and to drive these numbers down so that we can keep them down and start to open up with those further safe and steady steps. There are 26 healthcare workers who are active cases. We thank them for their work and all of their colleagues, many tens of thousands of them across the whole state. The rolling averages to 6 October are Metro 9.9, so under 10 for the first time. Regional Victoria just 0.3. In terms of mystery cases, so cases classified as unknown source, for the 14-day period to the 4th of October, 12 in Metro Melbourne, none in regional Victoria. The Metro regional split, no new cases in regional Victoria today, and there are just 2 active cases in regional Victoria as of today's update. In terms of active cases in aged care, just 58 active cases in aged care, so those numbers continue to fall, and that'll be a mixture of staff as well as potentially some residents. And when I say staff, it's the broadest context, so it's not just clinical staff, it can be staff who've got any connection to an aged care outbreak, and of course an aged care outbreak is just a single case, is treated the same as many more cases given the underlying vulnerability of people in those settings. In terms of active cases in disability facility settings, it's still just that single staff member, and hopefully that person will move out of our data once they have cleared the virus. The final thing I just wanted to say, can I just ask Victorians to pay close attention to the Vic Emergency app or the Vic SES website today, ses.vic.gov.au. There are some severe weather warnings, particularly in relation to what are expected to be significant rain events in some parts of the state. SES do a fantastic job, but if we can all just be aware of our circumstances, be aware of what's coming later on today and perhaps over the next few days, that helps them do their work. They are amazing, and we've seen them tested, but equal to that test in recent weeks and months with high winds and a range of other really difficult challenges. But if people can just across the state, particularly in regional Victoria, keep an eye out on that Victorian Emergency app and the SES website. My latest update was that there's significant rainfall expected in the northeast of the state, but everybody should be aware of those circumstances. That just makes the job of our emergency services heroes, both career and volunteer, just that little bit easier. Now, as you know, we've had a significant outbreak coming out of Chadstone, moving to Kilmore. There's been a lot of testing activity. Testing really is key to this, finding out what that chain of transmission looks like and then trying to disrupt that by having people isolate, having people have that appropriate public health response. Jerome is driving all of our testing across the whole state, and the numbers are strong. The community engagement is strong. We're very grateful to everyone who's come forward and got tested. We're very grateful to everybody, whether it be a cafe owner who's kept absolutely meticulous records of who has been in that cafe, all the way through to people who are honestly and frankly answering contact tracing interview questions. Testing is central to this, and